Hi, everybody. It's great to be here. And I'm going to be talking more about Blue Button and about opportunities we have in the next year to truly liberate data for patients. So digging into some of the things that Brian introduced earlier, I also just wanted to highlight the broader mandate for open data across government. One of my roles is to play an advisory health IT and health innovation role working with Todd Parker at the White House. And in May, the president signed an executive order calling on all government agencies to make newly available data, to provide it in machine-readable form, to turn the spout to open for all data for all Americans. HHS has played a key, important galvanizing role in this area, but this is true for all agencies in the future. So many of you know Jay Walker, famous for Priceline and for TEDMed. And he is the convener of his beautiful house, the Museum of Imagination. But he is also famous for saying that there's been no major shift in technology and the way we operate daily lives that hasn't been in some ways galvanized by consumers. And will the same be true for healthcare? Well, let's look at some of the facts. As you know, in a few days, we'll be opening the marketplaces for people to purchase affordable healthcare. And for the first time, we're seeing people directly purchasing healthcare in markets that work, where they get to choose the plans and providers they want, not just for federal exchanges, but also private. We're also seeing that 60% of workers in small firms are facing high deductibles. We're seeing that 70% of patients are going online for health information. We're seeing that 90% say that having availability of open notes would influence their choice of providers. So I think it's fair to say that inevitably patients will drive big changes in healthcare over the next few years. And this change is being met, as you've heard, by an equal realization among providers that things need to shift. And that if we are to make care better without breaking the nation's bank, we have to engage patients in being not just engaged, but drivers of the change that needs to happen. And indeed, patients truly are the most underutilized resource in all of America. And I love Carol McCall's image that we aren't patients, we are agents of improvement, and we need to make that happen. But just as for providers, patients cannot play that role without data. So if we want patients to help, we have to help by making their data liquid and available to them. In 2014, many patients will have access to machine-readable digital health information. This is what Brian referred to. Meaningful use, the incentive program that was instituted by the Recovery Act, gives patients the ability to view, download, and share their coded clinical data. View, download, share. And it's the share piece that we think is going to really unlock the most innovation and the most positive disruption. Imagine that you can share it with your mom. You can share it with your PHR. You can share it with your app and tool. You could share it by donating your data. And included in those requirements are the use of the direct protocol, which literally is creating a digital dial tone across America that does not require everyone to be part of the same network, part of the same HIE, but can allow for two disparate HIT systems to communicate in a secure way simply by deploying direct on each side. Now let me give you a sense of scale here. So how many patients really will have access to this data? More than 80% of hospitals are participating in meaningful use. More than half of all doctors. Hospital adoption has quadrupled since 2008. So 80% of hospitals in 2014, starting actually in October of this year, will be giving patients the ability to view, download, and transmit their own information. Now that's scale. Now, you might say, oh, that's all great, But we know that HIPAA is going to be a problem here. We know that when patients ask for their data, providers are often worried and concerned, sometimes legitimately and sometimes maybe not. So will HIPAA be a barrier? Well, Leon Rodriguez, the head of OCR, if you've heard him speak, he's amazing. He calls himself the HIPAA enforcer, and you believe it when you look at him. He says, no, the most essential right to information, in fact, one of the only rights in HIPAA, providers may use data, patients have a right to it, is patients' right to their own information. And starting 3 days ago, OCR clarified that that extends to digital data. You have a right to your electronic data. You have a right to it whether it's held by a provider or a health plan. Anyone covered by HIPAA has to share it with you electronically. You have a right to ask for it in the form and format you want as long as it can be provided that way. And you can have it sent wherever you want, even by unencrypted email, if that's your choice. So HIPAA, as he says, is a valve, not a blockage. Now let's add up the pieces. So HIPAA is giving everyone the right to send their electronic data wherever they want. Every EHR will be certified to send coded data to patients. Providers must offer the VDT, View, Download, Transmit capability to at least 50% of patients. Blue button specifications, which add things like triggers and certificate bundles, are making it easier for implementers. We are talking real data liquidity and an incredible potential for an innovation ecosystem, as Brian said, this year. Now, one of the interesting use cases that will be unlocked, and all of you have had the experience, you go to the specialist, you're referred by your primary care doc, you arrive, they say, why are you here? Now, you could say, I'm here because of the pain in my side, but you don't know what tests have been performed. You don't necessarily know the results. And if you try to remember, you might get it wrong. So the ability to have access to your clinical content in electronic form, whether, as Brian said, it's to check meds, to manage your care, to coordinate care when no one else can, this is the killer app for HIE. We certainly see regional HIE efforts. We certainly see direct creating a dial tone. But HIE of one, where I can have my information and share it as I want, is truly going to be a possibility. These changes will happen. They're inevitable. But it's up to us to speed them along. And the time is now. If you're a vendor or a developer creating products, whether on the EHR side or on the patient side, make it delightful. Make it easy to use. Give people access to their data. Think about how we create the most data liquidity in the easiest way for patients. Unlock the data and let it be innovated on. That's what we ask you to do. If you're a provider, what we've seen is where we have providers, even small practices, a solo practice doc in Kansas, she said 95% of my patients are engaged with their own information and using it. How did she do that? She invited them. She brought them in. She had them sit by her side and say, could you correct my info as I type it? Could you correct the info on the form that you sent? Could you make sure that the meds are right? Could you schedule online? And these are things that are already burdensome for the patient anyway. So the invitation is so critically important, and it's the only way that this is going to work. Patients, let's ask for our electronic health information. You remember the old Seinfeld episode where Elaine snuck a peek of her record. That's wrong. It's our right. It's our information. Let's ask for it. Let's lessen the tension, the friction around thinking it's the provider's data, and let's get our information. Let's use our information. Let's exercise our rights, and let's do it all this year. Thank you.